Thank you for the opportunity to share Orange County's Ending the Epidemic plan. First, I'm going to provide a little bit of background on Orange County's HIV care continuum, and then I'm going to give a high-level overview of our plan and our regional response. Orange County has seen increases in STD rates similar to what has been seen across California. However, HIV incidence is the only STD that has decreased. Preliminary data for 2019 shows there is a continued decrease in new cases. HIV medical care in Orange County is quite different than most counties. There are only 2 Ryan White funded HIV medical providers, and the county does not have a county hospital, but we do have 1 categorical STD clinic. As you can see from the care continuum, the viral suppression rate in Orange County is low at 60.8%. And when you look at the data for racial and ethnic breakdowns, Black African Americans, Latinx, and men who have sex with men are disproportionately impacted. When you compare our Orange County's care continuum to one of Ryan White's medical clinics, you can see the increase in viral suppression rate goes up to 85.7%. So when we were selecting an activity, we decided to focus on viral suppression for individuals in care at non-Ryan White medical clinical settings. So our Orange County utilized existing plans to align with the proposed Ending the Epidemics plan. Those plans included our integrated HIV prevention and care plan, CDPH is laying a foundation for getting to zero, and the national HIV and AIDS strategy. The overarching goals of our plan are to reduce new HIV infections, increase access to care, and improve health outcomes, and to reduce HIV-related disparities. As a county, we want to reduce new HIV infections by 75% by 2024. Community engagement and participation with non-traditional partners, including patients at risk for HIV, homeless service providers, probation, corrections, DCFS, MAT clinics, behavioral health clinics, and Veterans Administration. The list can go on, and we really need to be creative in our outreach to engage partners. As a county, we also need to improve our resources and messaging for Black African American, Latinx, and youth. 2019 was the first time Orange County created a media campaign related towards HIV stigma and STD getting tested, which is kind of crazy to think about 2019, but it was successful, and we're in the process of measuring that data. We really need to utilize social media, messaging, and apps. That's the only way we're going to reach our youth population. When I was preparing the slides, I felt it was necessary to also highlight the activities we identified in our HRSA Ending the Epidemics plan, and we proposed 7 activities. We started off with provider liaison to implement HIV standards of care, implementation of a rapid ART at one of the Ryan White clinics, provide HIV medical care to high acuity patients who may not qualify for Ryan White services. So with us only having 2 HIV Ryan White clinics in Orange County, one of our problems is that we only see clients who are uninsured in our clinic. So we don't see clients that have insurance. And we need to find a way to reach those clients that are insured but are not eligible for Ryan White. And so we plan to use some of this funding to provide care to those individuals. So we have individuals that have mental health issues, substance use issues, that don't manage, they can't manage going to a Medi-Cal office or making appointments with the Medi-Cal office or a Medicare office. So trying to identify ways similar to what Seattle does with the MAX clinic. So trying to have a small caseload of those patients that need most access to care. We also are looking to do a paid peer navigation program for PrEP. So part of our STD clinic, we do have PrEP services available. So really getting someone in the clinic that knows how to work with the various populations that is a peer within the community, and paying them to come in and work with our population to encourage PrEP uptake. We're going to do work on expanding our housing availability and develop and implement a strategic plan to address the syndemic for HIV, STD, and hepatitis C. We're also looking to hopefully implement a mobile testing unit. For our 1906 plan, we focused again around viral suppression patient incentive program. So we'll utilize our surveillance data to identify 9 non-Ryan White medical offices with a large number of patients who are not virally suppressed. The incentives will be used to engage patients in HIV care and to reach and learn how to maintain viral suppression. We will follow an intensive short-term ARTIS case management model, and there will be pre and post-test assessments of the patient's HIV knowledge. Patients really need to understand their lab results, how to know when they're receiving appropriate care, and empower the patients to know what questions to ask their providers. We will also include referrals for supportive services and treatment adherence counseling. So for our regional response, Orange County has a robust coordination of HIV activities, including a Part A Planning Council. We're part of the Ending the Epidemics statewide working group, and in October we held our first town hall meeting. We have HIV and STD integrated services, which I think is really important. So we can have a patient who tests positive in the STD clinic, and we can immediately enroll them if they're uninsured into the HIV clinic, which is nice. We're co-located, so it's a seamless transition. The problem is that because we do only see patients that are uninsured, then that's where we start to see issues with people engaging in care. So we do have processes in place, but that is an area we want to focus and improve. We're also part of a new STI coalition that's made up of numerous community organizations that are all working towards reducing STIs. In 2019, the Orange County Healthcare Improvement Partnership adopted sexual health as a new focus area for 2020. And Orange County's primary focus, so for our new approach, Orange County's primary focus will be to identify ways to engage people living with HIV to inform and write these plans. We cannot eliminate HIV without the direct input from the people affected by this disease. We quickly put these plans together because we had short time frames, but we really need input for people living with the disease. And we need input from people that are most affected. And this initial plan did not include that input. So over the next year, that's what we're going to be doing to identify how to engage those individuals. So needed regional structure and resources. Again, we need community input and collaboration. That's why I've made it red and bold and underlined. And as Mario stated, additional staffing. To implement these new plans, we need staff to be able to put these new activities in place. I got the stop sign. So the only thing that I want to add is that for the interjurisdictional collaboration, for the state and the federal partners that are here, we need to influence the HIV agenda and look at how we add HIV-related HEDIS measures, health plan accreditation, pay for performance, and that's my last slide, and health plan rankings. They all need to include HIV measures. Thank you.